Now what I would like to get into, I'm going to have the client to turn. We're going to have you turn on, doesn't matter which side, we're going to do both sides. Turn on his side. And from here, what we're going to get into as far as the upper body, we're going to get into the facet joints. The facet joints as well as the levator attachment. We're just kind of briefly going over some of the attachments and joints that we're going to be dealing with as far as for any type of upper body session. So starting that off, what I would do, would you mind taking your shirt off? Yeah. And I'm going to do is I'm going to start by depressing the shoulder blade, and I'm going to take the proximal knuckles, and from here, I'm putting all my body weight on him, and I'm going to just gently do a nice myofascial release down the traps, also kind of getting some of that levator attachment as well. And another thing that I like to do, this motion here is just kind of tell, like say for instance for people who, like say for instance with Angel, you know, he's right motor dominant as well, so that right shoulder tends to want to pull back and the left shoulder tends to elevate and kind of drop down forward. So what I'm doing here, I'll just put like a little bit of sap on there. And the reason why I'm doing this, I'm seeing which way the tissue wants to go. So going this way, the tissue doesn't really want to go that way. So I'm going back this way, because remember, like I was saying earlier, this shoulder already wants to go this way. So when I'm doing the tissue this way, it's real kind of taut and leathery. But when I go back this way, the way that it doesn't want to go, or the way that it should be going, I'm getting a little bit more, getting less resistance. So what I'm going to do right now, I'm going to have Angel to gently shrug your shoulder toward your ear. Good. And relax. And then a nice, slow myofascial sweep on down. Now, from there, what I'm going to do is I'm going to kind of put him in a little bit of flexion. Here, whatever is comfortable for the patient, put him here. And now what I'm doing, I'm going in his laminar groove and searching for any kind of restriction, any type of fourth layer muscle fibrosis, or any joints that, any facet joints that may be stuck open or closed. And we've got a little bit right here, which also might be some ribs, or it could be some rib dysfunction as well. And I just apply pressure to treat the fourth layer muscle fibrosis. And I'll just be scanning up and down his laminar groove, finding spots, and then treating that as we go along. Typically what we do is we'll go all the way up to the suboccipitals and work our way out to the anterior scalenes as well. So just kind of going up, some finding and treating as we go. Now, if you notice me moving, that's not me pressing on the tissue. That's whatever I'm treating, releasing. That's it actually moving my body, because I'm not forcing it. I'm doing what's called encouraging the tissue to release. And we continuously do that until I find a bony knot, which would be that joint that's either stuck open or stuck closed, and treat that as well. Now from there,